Hello, how are you, my subscribers, my followers all over the world? And today I want to salute the Muslims for having fasted for a full month. Thank you for embracing the call for Allah and what it tells you what to do. Happy Eid all over the world. I love you, my subscribers who are Muslims, and for you, my returning subscribers, I love you so much. And therefore, if you haven't subscribed, please do the needful. You know, in our previous topic, we discussed about signs of a twin pregnancy, and I thought this would be also so much important in order to follow our subsequent videos that we have been putting up to know why people should attend antenatal. Today we're going to talk about reasons, advantages, and aims of attending antenatal. But first of all, what is antenatal care? Now, this is a so much important topic that all of you have to listen to, both the man and the woman, the husband and the wife, because this is so much important to both of you, not only the mother. Just like men have always neglected their mothers or their wives to attend antenatal alone. You know, it is so much important for both of you to go together. As we look at the advantages, you will know why you, the man, the husband, listening to me, you should go to attend antenatal. But first things first, antenatal care is a comprehensive, comprehensive, it means that we do a lot. It is a focused, goal-centered health care given to a pregnant mother when to carry out the course of pregnancy or throughout her course of pregnancy. Do you know why you have said it is focused? It's because that we do focus on those important aspects per visit. So we do care for this mother. We carry out a comprehensive approach to her health, and in order to cater for her and the baby she's carrying in her womb until pregnancy. This has been so much question to so many people. That how many visits that should a pregnant mother have in antenatal? You know, World Health Organization has told us, or has always advised, that they are supposed to be 4 visits. However, the visits can change depending on the type of pregnancy. Therefore, when you attend antenatal, doctors will carry out both physical and laboratory examinations. They may carry out breast examination, they may carry out body examination, they may also carry out laboratory investigations. And depending on these, the doctor will determine how many visits you're going to attend in antenatal. We will determine the type of pregnancy you're carrying. We have 2 types of pregnancies. We have what we call low-risk pregnancies and high-risk pregnancies. Only when you attend antenatal, it's when you can understand this. Low-risk pregnancies are pregnancies that do not have medical conditions attached. This is a mother who is carrying a normal pregnancy. And a high-risk pregnancy, this is a pregnancy that is having some other medical conditions attached. For example, you could have hypertension, you could have diabetes in pregnancy, you could have any other chronic illness, maybe HIV or sickle cell. So mothers who are having high-risk pregnancies will not attend only 4 visits of antenatal. You can even have 2 visits a week. Whereas mothers who are having a normal pregnancy can only have 4 visits of antenatal. What are the aims of antenatal care? Why are we telling you to go and attend antenatal? Just like in my previous video that I told you about of a twin pregnancy. This is when we can only detect you're carrying a twin pregnancy. This is the only time we can detect medical conditions that may complicate your pregnancy. And therefore, this is only the time that we can detect the complications your pregnancy may cause to you. We also attend antenatal in order to promote your health and also to promote the health of the baby you're carrying in your womb. This is why antenatal care is so much important. This is why it is focused. This is why it is comprehensive. We look at you, we also look at the baby and the husband. Why? This is when we are only going to know, why are you coming alone in antenatal? That my husband left me, my husband died, my husband does not care. This is the only time we can know why a mother is coming to the antenatal alone, and we will be giving you the different ways how you can carry on your pregnancy until delivery. Now, Important to talk about now, we are going to look at what is done in these antenatal visits, and most especially we are going to begin with the first visit. In the first antenatal visit, it's mainly identification. We do take history of you are the mother. What are you? Who are you? Where do you come from? You know, some mothers come when their husbands have already gone. They have passed on. This is the only time we can know. We take your BP, we carry out, BP is blood pressure. We check your glucose levels, we test for malaria, we do ultrasound scan. This is mainly done in the first antenatal visit. In other words, it also helps us in the nurse-patient relationship, the nurse-mother relationship, doctor-mother relationship, because this is where we are going to bond with the mother. We are going to ask you a lot of questions just to understand why you have come to antenatal and for us to know you physically as a mother. Then in the second visit, we mainly look at the maternal and the fetal well-being. We look at the position of the baby. We look at you, the mother, how are you feeling? We begin planning for delivery. This is all done in the second visit, and it's also the same thing that is done in the third visit. Yes, in the third visit. Now, the first visit, mainly the fourth visit, we do emphasize points. We do emphasize situations that happen in pregnancy. We begin telling you, when you see blood, do this. When you feel a fast heart rate, do this. We do also tell the mothers to plan where they're going to deliver from. Get contacts of the border, get contacts of the taxi driver, get contacts of the cab driver. This is done in the fourth visit. We do always tell the mothers about this. We do delivery plans. We do tell you, plan for this. When you see this, do this, because we try to prevent these complications. So mothers who are there, these are some of the reasons why you should attend antenatal. Now, advantages of attending antenatal. Listen to me. It creates a bond between the mother and the husband, or the man and the wife. Most of the times, the only time the man and the woman are together is in the bed. When they get out, this one drives to the north, the other one drives to the west. They only meet again when they are home. So antenatal creates a bond. It makes you get more knowledge. Instead of being ignorant, you get to know so much things when you attend antenatal when you are two. Then the other, it creates a bond between the mother, the father, and the baby in the womb. I have seen husbands that come and they try to put their ear on the abdomen of the mother, what you call the stomach. You know, they put their ears, try to listen what is there. I've attended so many baby showers, and you find a man is putting the ear on the stomach of the mother or the abdomen of the mother. Why? He's trying to create a bond with the baby. So the only time the mother can create a bond with their baby is when they have come to antenatal together. So mothers who are listening to me and the fathers who are listening to me, antenatal is not only for the mothers. No, you also have to come and follow up with your mother into antenatal. Now, the other is it creates screening for you. It creates screening for the mother and the fetal health well-being. It helps you to get screened. First of all, as a mother, you are screened for different diseases. For example, syphilis, to mention but a few. So when you attend antenatal, we not only look at the baby into your womb, but also as a mother, we try to detect a lot of things that could affect you in pregnancy. And then the other is we prevent unwanted pregnancies. You know, in antenatal, we also talk about family planning. We tell you now, you know what, mother, yeah, this is a pregnancy you have carried. When you deliver, at least give yourself 2 years in order to add on another baby. All this is done into antenatal. We do give counseling and guidance. You know what, you're carrying a twin pregnancy, but this is the only way you can do this, the only way you can do ABCD. Carry out this and that in order to give a spacing to your children. You know, even if you're rich, it is not very good to carry babies subsequently. After 6 months, you are again pregnant. At least a space of 2 years, 1 year is always good. So we prevent unwanted pregnancies in antenatal. And then I don't know whether you've heard of people telling you that a mother wanted to eat her baby, a mother wanted to beat her baby. Now another important is post-maternal psychosis. This is another important point why you attend antenatal. We do prepare this mother. It is what we call psychosis. Psychosis is when a mother almost runs mad. You've had mothers who beat their newborn babies, who wants to eat their newborn babies. The pregnancy has affected their understanding and their thinking. They feel like they can do anything to this baby. They feel like they don't want their baby. They feel like they are tired of being mothers. So unless you attend antenatal, you cannot get all this care that we give to you when you are pregnant. I'm your friend Royal Mark. Thank you for listening to me. Go and enjoy Eid, my Muslim friends, and thank you for inviting us wherever you have invited us. We shall eat, but the most important thing of all is to thank you for embracing what Allah told you to do, and you have fasted and you have embraced the 30 days. And I hear there's what we call sitat, that the days you fast after this period of 30 days. May you do it so that Allah continues to bless you in this period. I love you so much. Stay behaving the way you have been behaving when you are fasting, so that also God blesses you so much. I love you. May God bless you, and bye-bye.